And there is one more, another question, which is the patient death. How to deal with patient death here in Saudi Arabia, especially in Islamic religion?
Yes, sure. This question also, the Saudi CDC just published before 1 month this guideline how to deal with this patient from corona. And they give the different precaution, and this is under the medical intervention. They can do everything in the Islamic rule how to deal with this patient with corona. So everything is published and well written in Saudi CDC.
Okay, thank you very much. The last question, which is the ethical things or the ethical rules that you discussed in your lecture. Is it specific for the Saudi Arabia, or it's for COVID-19 only, or it's for any infection that may spread?
Yeah. Almost of them are internationally accepted. There are just a few, 2 or 3. It's related to Islamic environment and Islamic society. This is we can apply it here. Like the priority of care of cases, this is different from country to other country. So this is unique for Islamic society. The other is internationally.
Mm-hmm. Okay. Thank you very much, Dr. Ali. And just there is one question. I think it belongs to our webinar yesterday, which is if coronavirus is transmitted from animal to human being. So if we control the virus in a human being, how can we prevent it from being transmitted again from animal to human being? Let me maybe answer these questions because it's related to yesterday lectures. We will deal with this issue like what we have done with MERS-CoV, which was transmitted from camel actually to human being. So the most important thing is to identify the agent, which agent. So in COVID-19, still there is some research going on regarding the agent himself or the animal itself. So this is the first thing we have to identify. We have to get the immunity. So as what Dr. Bersana talked yesterday and Dr. Danish, so we have to be vaccinated first thing, or get infected, then you will have the immunity. So if you have the immunity, even we can provide the vaccine for the animal as well. So if we control these things, inshallah, we will prevent the infection.
Also, Dr. Maad. Also, Dr. Maad, I'm sorry to interrupt you. According to Middle East Respiratory Syndrome coronavirus, the guideline published in 2018 that listed how to deal with the human-animal interface, and they mentioned a lot of advisement how to deal with that. So I think this is also the good reference for this question.
Okay. There is one question also, Dr. Ali, about the ethics number 9. I don't know what was in the presentation. So if you have the presentation in front of you. Number 9, what is the exception of patient privacy? If there is any exceptions to break maybe the privacy of the patient? Yes, we have exception. For example, when we're dealing with the patient in education purposes, the healthcare practitioner need the student just to break this through and to attach to the practitioner to how to do the proper examination on the patient. This is only in just a specific situation. And also the confidentiality we have, like in communicable diseases and so on, we can break this issue just when dealing with a specific situation, not all. Okay, thank you very much. Now we will go to another major thing that could happen actually in COVID-19, which is shock. Dr. Muhammad Shabir, he is assistant to professor of medicine, will direct us to how to manage and diagnose COVID patient in COVID-19 who is suffering from shock. So welcome, Dr. Shabir, and mic is yours.
Thank you so much. Assalamu alaikum. I hope everyone hears me. Is it okay?
Yes, it's clear.
Thank you. First of all, I'm very much thankful to the Sure platform members who gave us the opportunity to present and talk about the global issue that is COVID-19. Secondly, I'm also thankful to the administration of College of Medicine, Dean, the Vice Dean for Academic Affairs, and Vice Dean for Quality and Development. And last but not least, I'm also very much thankful for my medicine colleagues and the seniors who are always an inspiration and a guidance for me. And Himaya, as you saw his support, that my laptop was not connecting, so he gave me the opportunity to be in the webinar platform. The topic given to me is shock in COVID-19 and how to diagnose shock and how to manage it. So shock is something by definition. Okay, so by definition, shock is something when a patient presents to the medical encounter with a new and sustained hypotension. By hypotension, we mean when the mean arterial pressure of the patient is less than 65 millimeter of mercury, or his systolic blood pressure is less than 90 millimeter of mercury. That hypotension sustains, persists, and the patient develops some signs of hypoperfusion. That is, the blood supply to the end organs and the tissues is compromised. And that hypoperfusion then later on causes inadequate oxygen delivery to the tissue. That is, the cellular hypoxia starts. And that cellular hypoxia persists, the tissues are at risk of developing permanent damage. So if we do not intervene in between, that is through support with IV fluids or some vasopressor agents, the patient and the organs may completely get damaged or die. So that is actually the definition of shock, which is equal for COVID-19 and for those patients away from the COVID-19. The COVID-19 is a disease which may present in asymptomatic phase, mild, but there is some population which can present as a severe form in the form of shock or acute respiratory distress syndrome. One thing which should be kept in mind that the course of the shock does not start abruptly. There must be some preceding history of some severe illness because of COVID-19 with some days of critical